Welcome to today's presentation on managing psychological distress during COVID-19, brought to you by Alliant Health Solutions. My name is Shanika Jones. I'm a licensed mental health counselor and a quality advisor with Alliant Health Solutions. Alliant is a strategic partner in the National COVID-19 Resiliency Network. The National COVID-19 Resiliency Network is a national initiative designed to mitigate the impact of COVID-19 on populations disproportionately impacted by the pandemic. I'm so excited that with us today we have Dr. Ann Shillingford, Associate Professor of Counselor Education at the University of Central Florida in Orlando, Florida. How are you doing today, Dr. Shillingford?
I am doing very well, Shanika. Thank you so much for having me here with you today.
Yes, sure. We're so excited for this discussion today. But before we dive in, can you tell us a little more about your background and why this topic of psychological distress during COVID-19 is so important to you?
Sure. I am an associate professor, like you mentioned, at University of Central Florida, and my role is to teach master's and PhD students who are seeking to be licensed mental health counselors, school counselors, marriage and family, and also be in a doctoral program. My background is in school counseling, so I have a significant passion for working with children and families. A lot of the courses that I teach at UCF are related to children and how to support children. And I'm also passionate about doing research related to disparities amongst people of color. So looking at health disparities, educational, social disparities, and the wellness that surrounds the individuals, or the lack thereof wellness that surrounds individuals and groups from marginalized populations. So I am really excited to be here to talk a little bit more about mental health, mental wellness, mental distress related to COVID-19. To me, it's also very important that I seek this platform, because one of the most significant effects of the pandemic has been suicide. And you will read several articles and maybe listen to the news, and they'll talk about the decrease that we've seen in the overall suicide rates amongst populations in the United States. However, if you look closely, you will see that there's been an increase in suicide rates amongst people of color. For example, 30% increase among girls, Black girls and women ages 10 to 24, 30% increase in suicide, 23% among Black boys and men, 40% increase among Hispanic women, and 20% among Hispanic men. For Native American, there's been a 5% increase. Asian women ages 15 to 25, a 30% increase. When you tag all of that on with other things that are happening, teachers shortage, you talk about school psychology shortage, bus driver shortage, all of those things that are impacting the lives of the people around us and ourselves as well. To me, that's most important for us to talk about it, at least for me to talk about it.
Oh, definitely. And, I wasn't even aware of the suicide statistics that you just mentioned for, amongst people of color. So, thank you for sharing that information. And so I think it would be helpful to establish a working definition for our discussion today. And so can you share with us how psychological distress is defined?
Certainly. So in the context of everything that I'm sharing today, psychological distress, I'm going to define as unpleasant or excessive emotional or behavioral reactions to different situations such as trauma.
Okay, thank you for that, clear definition. And so now that we know, how we're defining psychological distress, what are some ways that you're showing, or what are some ways that you're seeing it show up in children and adults?
Sure. So some of the key signs that have been noted, whether in schools, at home, and communities, have been disturbances in sleep habits. Some are sleeping too much, some are sleeping too little. Children are having more nightmares. There's been a withdrawal among people of things that that folks enjoy doing, the activities that we've enjoyed doing. Some just don't want to do it anymore. They prefer to stay in at home. Excessive worry about what might be. There's been an increase in at-risk behaviors such as substance use, smoking, and that is not just adults, also among youth and young children. Low energy, increase in complaints related to physical ailments like headaches and stomachs, and individuals who have chronic health issues. There have been a significant increase in complaints with those issues as well. With children not wanting to leave home, not wanting to go to school, significant difficulty in concentrating. So you'll hear the teacher saying, I don't know what else to do with these children because I can't get some of them to stay focused and so on, excessive crying, and for some feeling guilty, feeling helpless and hopeless as well. Those are some of the significant psychological effects that we've been seeing.
Mm-hmm. And so some of those symptoms kind of touch on, what some of the short-term consequences are, like you mentioned, difficulty concentrating, or, worry to the point where you're not leaving the home, or, having nightmares.
Mm-hmm.
Are there any long-term consequences if we're not managing our psychological distress?
Absolutely. Some of the long-term effects that we've seen is, one, going back to what I said, the decrease in work performance. That is most likely going to lead into academic deficiencies in the future as children go up in grades. If they go up in grades, hopefully they have the support to do that, but that is significantly affecting their academic performance. With individuals, when you look at the health issues, increase in heart rates, blood pressure, more panic attacks, or individuals are more at risk for panic attacks. We have those who are at risk for health issues such as cardiovascular disease. And when we're talking about disproportionate populations, let's say, for example, the African American or Black population, who are already at risk for cardiovascular disease, and then you tag on the stress and anxiety related to the pandemic, that is of significant concern as to what is going to happen or what is happening amongst this population health-wise. Also increase in mental health disorders. So a lot of what I mentioned before when I described psychological distress, those were just that, distressing signs and symptoms. If we do not do anything about those things, if we do not seek support or get the children or whomever the support that they need, then we're looking at potential mental health disorders that these individuals may then have to may then encounter.
Mm-hmm. And so, the information you're sharing really just highlights the importance of taking action and trying to, be somewhat proactive about things. And so what are some things or some ways that we can improve our psychological well-being during this pandemic?
First of all, awareness is key. We have to be aware of what we've experienced and what we continue to experience. And I say it needs to extend beyond just who we are, beyond our families, into the community. So awareness is key. Know what the signs and symptoms of psychological distress are. I just mentioned some of them, and I'm sure we'll have a resource available with other signs and symptoms to look for. Know your support system. So if something is happening, who can you talk to immediately? Who can you get on the phone to and say, hey, this is what's going on with me. Can we talk? Do you have a minute? Talk about the distress within your families, within your communities, within the school. Have those bold conversations. In the past, talking about mental health was considered taboo or just a stigma, but now we need to openly continue to talk about mental distress, trauma, what we've experienced. Some have experienced loss, death in the families. I'm doing a study with young children right now related to COVID, and some of them that we've interviewed are talking about having lost parents, grandparents, other family members. Families have lost their jobs and so on. So talk about what that means for each other. And it's also important to talk about those things at home, because even if you've not experienced any of those things within your family circle, when your kids go out into the community, when they go out into the schools, they are most likely encountering conversations among their friends, even the teachers, who may have experienced those significant loss. And so it's important that we talk about it at home, so that if the conversations come up outside of the household, the children understand what's happening and they know that it's okay to talk about it. They know that it's safe to come back, find an adult to talk about it, especially if they don't understand what has been happening. Something else I think that we need to do is draw into our wellness. Whatever wellness practices we had before, do more of it. What your spirituality is, especially spirituality, is key. Lots of studies have shown that among people of color, spirituality is one of the most highly mentioned and practiced wellness events. So whatever your level of spirituality is, do more of it. Connect with people, connect with things. And it might sound strange for me to say connect with things, but connect with things such as nature. Go out into into communities, go out into the park, the playground, take the kids out and just breathe some fresh air. All of those things help our mental health in order to function more appropriately. And then you have the basic things like diet, exercise, being mindful of those things, relaxation, making time for self, making time for families. If it means going to hide in the bathroom for a few minutes, do that, whatever that means for you. And self-compassion is so important for us. Forgive ourselves. You make a mistake, maybe you yell at your child, you yell at your partner because you were upset about something. Be compassionate to yourself, forgive yourself, and move on. We can't hold on to those hurts anymore, because it's just so much that has happened, so much has been compounded upon us that we can't add anything else that we can control.
Yeah, great suggestions. I've actually tried the hiding in your bathroom before myself, so that's something that I keep in my little toolbox. So great
Yes.
suggestions. But
Yes.
so now that we have some practical ways that we can improve our own mental health or psychological well-being, do you have any suggestions of things that someone could do if they know someone who is having suicidal thoughts or thoughts of self-harm?
Absolutely. First is express that it's okay to ask that person directly. So you've seen someone, you observe behaviors that are not the norm for that person, you suspect some behaviors, ask the direct question. Do you have thoughts of killing yourself? Do you have suicidal thoughts? And sometimes I've heard people or I've read of individuals saying you should not ask that question because then you put in those thoughts in the person's head. No. What we're seeing is by opening that conversation, by asking that question, it has actually helped to de-escalate individuals who are contemplating suicide, because then it shows that here is this person who is connected to me, who cares about me enough to ask me that question. And so if you see it, ask a question, ask the direct question. There are other resources within communities nationally that people can tap into, like the National Suicide Prevention Hotline. For anyone listening, the number is 1-800-273-TALK. That is 8255. And they're available 24/7, available also in Spanish. So that's another resource to tap into. Within schools, there are school counselors, there are school psychologists, there are school social workers, and other individuals, teachers who are available to talk to if someone is having suicidal thoughts or thoughts of self-harm. For adults in the workplace, there's the EAP, Employee Assistance Program, I think it is, that you can contact, and they will connect you with resources or therapists in the area. And also call your health insurance. If you have health insurance, call your health insurance, and then they can help give you resources that you need to support those individuals. And also in the state of Florida, we have something called Baker Acting, and I think that might be specific to Florida, where if you see someone or you know someone who is thinking about suicide, you can connect them with a community agent. You can also call the police, and they will come and provide resources, take that individual somewhere where they can provide resources and services to support them. And the last thing I will say about this is to not fit into assumptions or any stereotypes. Sometimes we make statements when we see people acting differently. Oh, she's just lazy. Oh, he's just seeking attention. Now is really not the time for those assumptions. Like I mentioned, if you see it, reach out, ask those questions, encourage the person to seek support.
Thank you so much for sharing that important resource and really all of the valuable information that we've heard today. It has truly been helpful. And as we close, I've heard the saying before that adversity often presents opportunities. Are there any positive things that you've seen as a result of the pandemic?
Absolutely. The pandemic has really forced people to come together to support each other, to build more connections that we would not have normally done so. Even something as Zoom, the virtual platforms where people are able to continue to meet and to see each other and to share information, share resources. So a lot of that has been happening, a lot of positive conversations. We're also seeing folks are being more proactive within communities, within schools, even the government, different states and educational systems are being a lot more proactive when it comes to mental health, mental wellness. Instead of seeing it as a stigma as we did before, we're seeing that the need is more significant, it's more important, and so more activities and more resources are being made available to support families, children in the community related to mental health and mental well-being.
Great information. Again, thank you so much, Dr. Schilling, for sharing your knowledge and your expertise with us. I see why you're a professor, because you've even taught me so much during this presentation today. So we just truly appreciate you taking out the time to provide us with this valuable information and all these resources. Thank you again so much.
And thank you, Shanika, for having me here today to share such important information. And I truly hope that we continue to support each other and take care of ourselves, because we need to do that.
Absolutely.